exhale, and then as he's breathing in, making a seal, you activate it. And then hold for about 5 or 10 seconds before he exhales normally. And then make sure you recap it when he's done. So I would assist him with doing that. If it was easier, you could put a spacer. If the doctor decides that he could send a spacer home, which is a bigger version of this, because obviously this doesn't fit. And he could breathe through that, which might be a little easier for him. So this has a little dose counter back here, or ideally, like, there could be about 200 puffs in here. And if all else fails, if this isn't here and he has no idea how many he's done, if he puts the canister in water, if it floats, then it means it's empty. If it sinks, it means it's full. This needs to be stored at room temperature. And if for some reason he does need to do 2 puffs, even though it's only calling for 1 puff twice a day, if he did need to do 2, he would probably want to wait 1 to 2 minutes before taking his second puff. So his last medication is a dry powder inhaler called Spiriva. Unfortunately, I don't have one here to show you that I know how to use it, so I'll try to do my best to explain it to you. Spiriva is a long-acting muscarinic antagonist. It's also a bronchodilator, and it's to help assist with reducing some of his flare-ups. So that's 18 mics per puff, which he is doing daily, 1 puff. So it might cause a dry mouth, it might cause a sore throat also. The Spiriva ideally is not considered a rescue inhaler. He does need to remember not to breathe into it while he's giving him his medication, self-administering himself his medication, because it will create humidity within that inhaler. So inhalers, probably a little circle like that. You remove the cap. You take a capsule out of the blister. You lift up the mouthpiece and drop it in, and then you close the mouthpiece, and then on the side there's a green button that you're going to push. And that when you close the mouthpiece down, you want to make sure you close it against the base enough to hear it click, and then you would push the little green button on the side to pierce that capsule inside the inhaler itself. And then the difference with the dry powder versus the meter dose inhaler is it's going to be a fast, deep breath in, versus the meter dose inhalers just a breath in. So again, he needs to exhale and then inhale fast and deep off of the mouthpiece on the DPI, and hold for about 5 to 10 seconds before he does a normal exhale. So we've gone through the 3 different ones. I'd make sure he didn't have any questions. I'd be more than happy to show him again if he needed that. That's not a problem. A lot of this can be confusing for patients. So he's got his small volume nebulizer, he's got his meter dose inhaler, and his dried powder inhaler. So then after all 3 of those have been done, and after the steroid, he would need to rinse his mouth out before moving on to his other medications. Just rinse it out with water and spit it out. So I need to reassess him, reassess his heart rate, rhythm, respiratory rate and pattern, and listen to his lung sounds. After his meds, I need to should encourage him to cough. He should try to cough especially after his small volume nebulizer with his bronchodilator and his dry powder inhaler on the other bronchodilator that he's got. Ask any other questions he might have. Leave the paperwork with him. Make sure he's comfortable. Make sure he doesn't need anything else from me before I leave. And thank him for my time. And then exit the room, wash my hands, dispose of my gloves, and chart my therapy and assessments. What I found, if there was any problems, I just need to make sure that I relay that on to the nurse, so that way she knows if it's anything that needs to be addressed before he goes home. That's it.